Hey everyone, this is Dr. Dolopo, and in this video I'm going to talk about two headache migraine cases, and one was written in 2011, the testimonial, and one was written in 2020, and it really shows how I've changed as a practitioner, but how I was able to effectively treat severe headaches of a woman who had seen me in her 30s. She started having severe headaches at age 9, so she was already 20 something years into having severe headaches, along with pain from head to toe. And then the other case study is a woman who had brain hemorrhage with migraines. And I will tell you, when I'm treating headaches and migraines, and this is just something I found over the years, is that the headache and the migraine, those are not the disease. I'm not chasing a disease. We're reprogramming the body's ability to function properly. The headache is something's wrong with me, like a sore throat. It's just a bell and it's an indicator of something that is fundamentally wrong at that moment. To have a headache here and there, and you pop an Advil or a Tylenol or Excedrin is one thing, but when it's something that's a daily thing, there is a fundamental issue with the core of your health. And so you treat the root of the problem and the severe headache goes away. You treat the root of the problem and the brain hemorrhage goes away. So I'm going to start with the 2011 case. It is now 2024. I started practice in 1999, and you can see how I've evolved quite a bit as a practitioner. I'm really proud of both of these cases, given the experience, the knowledge I had of Chinese medicine, how to execute acupuncture correctly. What I tell my patients now is you're catching me at 25 years of practice, not at 5, 10, or 15, or even 20. I'm constantly evolving as a doctor of acupuncture and Chinese medicine. And so that is important, because if I was still the same practitioner in 2011 than I was in 1999, I would not have effectively gotten rid of this woman's headaches that she had for 20 plus years. So again, if a person just has headaches here and there, if taking meds is not a big deal for you, take the medication. But if you're at this place in life where you're just done having these headaches and migraines, and you want to live healthy, you don't want to have to keep popping an Excedrin, you don't want to have to worry if a migraine is just going to pop up and you have to look for your migraine medication. You really want to go to the root of the problem. You might want to consider seeing a Chinese medical doctor. If you're here in Orange County or somewhere in Southern California, come see me. So here is 2011's case, elementsinharmonyacupuncture.com/headaches. Gina wrote this in 2011, and this is what she wrote. Before I found Anna in January of this year, I was in a lot of pain. My first car accident, severe whiplash, no broken bones, was at 9 years old. Fast forward through some hard jars, falls, and various other injuries in 22 years, I was suffering from debilitating headaches every other day. Upper, middle, lower back pain, hip and foot pain. For no apparent reason, my fingers would feel weak, would feel like they had been slammed in a car door. My shoulders would be drastically uneven every other week. It hurt to walk for longer than 10 minutes, and my neck was so weak. I had to hold my neck up when I would lean over to fill out paperwork or read. My chiropractor was sometimes seeing me 3 times a week to put everything back into place, but frequently these treatments held only 3 to 4 hours. Tomorrow will be my 75th acupuncture treatment, and I no longer see the chiropractor. I am now enjoying every morning because the headaches are not there. I'm no longer popping painkillers and living in a fog half of my waking moments. The numbness and pain in my arms and hands have left. The strength in my neck and back has increased, and my posture has improved greatly. We are still working on some lower back, hip pain and a faint weakness on my feet, but I can now wear flip-flops after being trapped in shoes that could accommodate my somewhat bulky $300 foot braces for over 2 years. Anna's kind words and treatments have given me the ability to live a much fuller life. The results I found with Anna supersede all others. Since my first treatment, my pain levels have gone down around 70%. I believe I need around 20 to 50 more treatments to graduate from my pain, just a little bit further to go until I'm pain-free, something that I never thought possible before I met Anna. I want to make it clear that there are people who come in for mild headaches, moderate headaches, and I can fix them within 2 weeks to 2 months. 80 to 100%. This is a case where I chose one of the most difficult cases in my career over a 25-year span, and that's still, hands down, one of the most challenging cases that I had gotten 12 years into practice. It pushed me as a practitioner. It really pushed my knowledge, how I'm executing my work with my clients, with my patients, and helping people what they need to do outside the clinic so that it can facilitate our work together. So why did I share that? That is hands down one of the most difficult cases I've ever had. I have had challenging cases since then, but probably in regards to headaches, that was one thing that I treated along with a myriad of other health issues. So if you know someone who's really suffering from chronic pain, and in her case it was 22 years post a severe car accident that she literally could have died from, when she was starting to CrossFit and lifting the tires and riding her horse and playing sports, I couldn't believe that was the same woman that I had started with, over a year before. It was great to see that she had been really healing. I think it was about 2 years in that I saw that she was doing all those activities. She could have not done acupuncture. She could not have. And she could have kept living with pain. This person went through the process of writing a very detailed testimonial to let the world know that because of our work together, the acupuncture and some of the other stuff that we did, but especially the acupuncture, because of the acupuncture, she was able to reprogram her entire body, and she was able to graduate from that pain. So let's go now to migraines. I've done this video. I wanted to put it in this video because the first testimonial was 2011. This one is November 2020. So 9 years passed between both cases, and in this case, in only 8 months, I was able to get rid of the headaches and the migraines. I see her, it's now 2024. I see her once a month, once every other month. No headaches, no migraines, no brain hemorrhage. And, or if a migraine does come, she's able to, do what she needs to do, and it gets rid of it immediately. So she doesn't have debilitating migraines. She rarely gets migraines, rarely. And when she does, she comes in and I fix it. This was during COVID, and when she started seeing me, it was February. There were very few clinics open, and she was not able to do the brain surgery, even if she wanted to. The surgeon said, you need to do brain surgery, but who was going to take care of her? Because she lived alone, and she was practicing safe distancing, so her mother was not able to take care of her. So logistically, in her life, she was not able to do the brain hemorrhage, the brain surgery to stop the hemorrhaging. This particular case is so important to me because it showed me the power of acupuncture, the power of Chinese medicine, being able to get a woman to really heal, go to the root of the problem, and treat the cause of the brain hemorrhage. So, Western medicine thrives when it comes to trauma care. In this case, we really not only graduated her from brain hemorrhage and migraines, but we were able to increase her quality of life, which is what we excel here at Elements in Harmony. So Laura said this: I have been going to see Anna since February. I highly recommend her for acupuncture. I started seeing her because I started to have migraines once a day. I started to have migraines one day. I never had them before. My doctor told me that sometimes that just happens and then you have to live with it. I didn't accept that. Living with migraines is not living. I would later find out it was due to a brain hemorrhage. But from that moment, I met with Anna. She gave me hope that I would not have to live with it. She knew she can help me. She knew she can help, and she could see I needed it. My eyes told the story of the pain I was living with. They had become bloodshot red from the pain. I started aggressive treatment in February, and after a few treatments, I could tell it was helping. It was like she was able to turn the dial down on the pain. it would take months before I would be migraine free, but I made it, and it was largely due to Anna's help. Once I found out the cause, she was able to adjust treatments to consider the brain hemorrhage. The doctors were not able to do anything really except pain meds that didn't work. I don't think I would be where I am today with her help. I am still going to Anna and will keep going because I have improved from her treatments, and I think she can continue to help me heal and stay healthy. Definitely go see her for pain. So February, March, April, May, June, July, August, September, October, November, 11. 10 months. 10 months. I think I said 8 months earlier. 10 months. We healed this woman from brain hemorrhage issues and migraines. And so I really want you to think about that. Is the acupuncture and some of the other things that I had her do that were non-invasive worth the not having to be cut open? So those are two cases in my career that mean till this day so much to me. And it's great to see Jay, the first case, on social media and living an exemplary life, living pain-free and living, her best life physically, emotionally, mentally, and I believe spiritually. And with Laura, with this case, to see that she has her life back. She didn't have to get cut open. I've seen people who they already had one or more brain surgeries, and I'm not saying they shouldn't exist, but if you can do something non-invasive first, and in those first 2 to 6 weeks see 30, 50, 80%, give it a chance, because then now you're giving your body the opportunity to heal itself. All right, so elementsinharmonyacupuncture.com. If you want to check out the first testimonial, it's /headaches. If you want to check out the second second testimonial, it's /brain. elementsinharmonyacupuncture.com /brain. 619-341-4341. That is my cell phone. Feel free to text it. Call the office. It always goes to my cell phone, 949-305-1703. We have other doctors who work here too. We do our best to be open 6 to 7 days a week, as well as having a neuromuscular sports massage therapist with over 20 years experience. She and I used to work at a local high-end spa together in 2003 on, and I've helped her have 3 natural babies. Little side note, go to naturalpregnancyspecialist.com and you'll let me make sure, naturalpregnancyspecialists.com /N for natural, P for pregnancy, F for fertility, S for specialist, TOUR, TOUR, naturalpregnancyspecialists.com /NPFS tour. And you will see all the work that we're doing these days for my natural pregnancy program. And we're so excited about it. All right, 619-341-4341. Give me a text and we will get you on the books for non-fertility. If it's for fertility related, please go to that website. All right, take care. Have a great day.